Right now, let's find out what's happening as far as vaccinations for teachers are concerned. We'll take you around the country. Of course, in Gauteng, we'll be talking to Heidi Jokos. Let's first head down to KZN, where we find our colleague. There he is, Deson Tathia. Also, Heidi Jokos standing by for us as well. Deson, where are you? What does it look like where you are? Today is the day that the teachers start getting their jabs.
That's right, Gareth, and lots of pressure to get that process underway. So we are in KwaMashu. This is one of the sites that have been allocated for teachers to get their vaccinations. This is where the provincial launch is actually taking place this morning. In fact, let me get straight to it. I've got the education MEC in the province with me, Kwa-Zulu Natal. Mr. Mshengu, thanks for joining me. So let's start with the numbers, for example, that we're looking at in the province. How many teachers need to get their jabs, and how many sites have been allocated for this?
We have 127,000 people that we're expecting to vaccinate in this program. And that includes educators, it includes cleaners, screeners, and basically everyone who works within the schooling environment, because that is the approach that we have taken at a national level. So the Kwa-Zulu Natal province has 127,000 people that are expected to be vaccinated within this period. In terms of vaccination site, we have worked with Department of Health to identify. In fact, these sites have been in existence since the beginning of the vaccination program. But we have worked with Department of Health to ensure that in each vaccination site there are stations that are allocated to Department of Education, so that when teachers come, they don't have to join the queue. They just get into their station, vaccinate, and then be able to do other things. But in total, we have 70 vaccination sites in the province.
MEC, how have you managed this process? I mean, on the one hand, you have, we all know that the vaccination is not compulsory, but at the same time, you as the education department would want to make sure that your teachers and all of the staff at schools are vaccinated. What has been the response from the staff?
The response has really been quite positive. The excitement from educators and other staff members that are working in our schools, they're quite upbeat, they're quite ready really to get vaccinated. There will be isolated cases, but we don't expect a huge number of teachers who will say, based on voluntary decisions, no, I don't want to go and vaccinate. But we do expect that there will be some. I was listening to one radio station when I was coming here. There were some teachers who were saying, hey, we'll rely on our self-prescribed medication, we'll rely on prayers and all of those things. We don't believe in vaccination. So there will be those teachers who we can't force, obviously, to vaccinate. But I can tell you the overwhelming number of educators in the province of Kwa-Zulu Natal will be vaccinated.
Now, as with any process like this, there's also been some that have been saying that the planning may not have been up to scratch. One of those is SATU. They had sent out a press statement recently saying that they were unhappy. They say that in some cases they were not actually involved in the planning, but were rather just given a report back. They're also convinced that there will be chaos, as they've described it, in some districts. How do you respond to that?
Planning is a function of management. We have consulted unions, we have consulted SATU and all other unions. When they complain about not being involved in planning, we have been addressing this matter for quite some time, that we can't, as a department, the management of the department, go and meet with stakeholders without a plan. It doesn't work like that. We will plan, and then once we are in sync, everyone in the department, we then go and consult with the stakeholders. Because if you go without a plan to them, they will accuse you again and say, but you're coming here without a plan. So the issue of planning is one process, but what we have done, and we have not failed to do so, is consultation with them. And they are not disputing that they have been consulted. Obviously, they are raising other matters, such as the fact that there are districts where the vaccination centers seem to be small in terms of number. But the issue here is that as we're working with Department of Health, the issue of capacity from Department of Health was also brought up. We'll remember that, or we will rather know, that this is not just an ordinary vaccination that is taking place. There is some kind of a specialization that comes with a vaccination for coronavirus, including the issue of storage and the percentage in which we can store those particular vaccines in terms of the cold storage rather. So it could not be that we could bring vaccination sites closer to each and every school.
Thank you very much, Mr. Mshengi. All the best for today. Gareth, that's the Education MEC. Just as we get this vaccination program launched in the province, we will be hoping to engage with some of those teaching staff that will be lining up this morning.
Looking forward to hearing their opinions of how this is all rolled out as well. Dason, for the moment, thank you for joining us from down in Kwa-Zulu Natal. Let's bring you up to